Piles or hemorrhoids in pregnancy literally make you feel like your asshole is sat on a bunch of grapes, and they are horrific. If you want to know more, then have a watch and save of this video. So piles or hemorrhoids, as they are medically known as, happen during pregnancy because you have the hormone progesterone relaxing everything. These are much more common towards the end of pregnancy because then you've also got the increased pressure of your baby and the placenta and your pelvic floor and your rectal muscles. And then what happens is the blood vessels that are inside the rectum enlarge, and then they start to protrude because of those hormones and because of the pressure that's happening above it. Now, it's important to note that hemorrhoids can happen both internally or externally, and for many women they might have a combination of both. External hemorrhoids are a little bit more common postnatally because as a woman pushes and has a vaginal birth, it can push out any internal hemorrhoids that she may have had already. And it's important to know that anybody can get hemorrhoids or piles during their pregnancy or postnatal period. Everyone is at risk. Even outside of pregnancy, there is no real risk factors. Anybody's at risk of developing them. And it doesn't matter whether you birth your baby by a cesarean or a vaginal birth, again, they can happen to anybody. So how can you help with hemorrhoids? So one of the things that can exacerbate and make hemorrhoids worse is constipation. So it's really important to eat plenty of fruit and vegetables and whole meal foods in your diet. Avoiding straining is really important, so have a step underneath your feet when you go to the toilet so that your knees are higher than your hips. That will relax your anal muscles a lot easier. It will enable you to go a lot quicker as well. Also think about breathing techniques that you can use that will relax your anal sphincter and therefore help to actually go more easily. Regular exercise is also really important. That will help, and avoid sitting for long periods of time. So get yourself up and moving around. Cold compresses can really help provide a lot of relief for hemorrhoids, and using wet wipes or reusable wipes can be really useful at providing that relief to you as well. 60-degree wash, that's all you need at home. It's also important to pat and not rub the hemorrhoids themselves. Things that you can also do include using hemorrhoid creams, so you can get over-the-counter medications and remedies. Just speak to a pharmacist in your local area or speak to your midwife. And the other thing is, if you are constipated and that's what's causing the hemorrhoids, then ask for some laxatives through your GP or through your midwife, who again will be able to recommend based on your individual medical history. And finally, hemorrhoids are a really crappy symptom of pregnancy. If they haven't eased within 6 weeks of birthing your baby, please go and speak to your GP and get an assessment on them.